Good evening. You are joining us live for this month's episode of Science Stream. Welcome. We'll be starting our broadcast in a bit. Meanwhile, please make yourself comfortable. If you have any questions for our guests, you are welcome to leave them in the comment section. See you shortly. Hello once again, especially to those who have just joined us. I'm Sean from Penang, Penang's very own Science Discovery Center. As COVID-19 cases are on the rise again in Malaysia and Movement Control Order MCO reimposed in most of Selangor and Kuala Lumpur, the question on everyone's mind is, when or will we ever see the light at the end of the tunnel? Will the newly announced Hotspot Identification for Dynamic Engagement (HIDE), utilizing artificial intelligence (AI) and big data analytics, be the weapon to get us ahead of the pandemic curve? How bad is vaccination hesitancy in Malaysia, and is it affecting our National COVID-19 Immunisation Programme? Dato Dr. Musa Mohd Nordin, a consultant paediatrician and neonatologist at Damansara Specialist Hospital, is someone who has his finger on the pulse of COVID-19 developments in Malaysia and worldwide. In this month's episode of Science Stream, he will address all those questions above, as well as share with us lessons we can learn from the global COVID-19 response and vaccination strategy that can help us reach the endgame of COVID-19. Dr. Musa is a 1982 graduate of Cardiff University in the United Kingdom. He's a consultant pediatrician at Damansara Specialist Hospital and also a clinical professor at pediatrics at KEJ International University College. Since 1999, Dr. Musa has served on various international advisory boards related to vaccines and immunization. These include advisory boards related to pneumococcal, meningococcal, measles, mumps, and rubella, human papillomavirus, hexavalent influenza, and dengue vaccines. He is a founding member of the Asian Strategic Alliance on the Prevention of Pneumococcal Disease, ASAP, Malaysian Influenza Working Group, HPV Coalition Malaysia, and Immunize for Life. Dr. Musa is Chief Editor of the Federation of Islamic Medical Associations FEMA Yearbook and sits on the advisory boards of MIMS Pediatrics and the International Journal of Human and Health Sciences. His latest book, Immunization Controversies: What You Really Need to Know, has been translated into 4 languages. Without further ado, please join me to welcome Dr. Musa to Science Stream. Welcome to Science Stream, Dato. Thank you for agreeing to be with us today.
Thank you very much.
So throughout this program, we will be conducting some polls for our live audience to let us know their opinions on the subject that we are discussing tonight. And the first poll for tonight that we have is, how is Malaysia performing in tackling the COVID-19 pandemic? Okay, so let us know what you think. A, do you think that Malaysia is doing great? B, as well as we can manage? C, things could have been done better? Or D, not good at all? Okay, so join us on Facebook to participate in the live poll if you're on YouTube, and click on one of the options below. Don't worry, as we won't be able to identify who answered what, not even us here. Dato, Malaysia had COVID-19 relatively under control by the mid of 2020. But we are now seeing a rise in COVID-19 cases again. When did it start to go downhill? What can the government and the rakyat do now to get ourselves ahead of this pandemic?
Assalamualaikum and very good evening. Thank you very much, Sean. Thank you, Fatin, who's in the backstage. If I can have my slides, then I may be able to answer some of your concerns that you have outlined. Great. Okay, next slide, please, Fatin. Right. This is my brief for the next half an hour. Firstly, very quickly, look at Malaysia on the COVID-19 map, yeah, and then what exactly is the end game, yeah. This is FTTIS-V. We will discuss this in much detail, and then the V stands for vaccine. Is it safe? Does it work? And then very quickly look at issues of hesitancy and refusal, and then wrap up. Next slide, please, Fatin. You see, this was us in the mid of last year, yeah. This is the BRIMS nation, i.e. Brazil, Russia, India, Mexico, the United States. They were on the uptrend, yeah. And where was Malaysia? Next slide, please. We were doing extremely well, yeah. And next slide, please. And the reason why we were doing very well was because we in the Asia Pacific had this culture of obedience in a way. We mask ourselves, we listen to our governments, yeah. Unlike in the Western nations or in Russia, whereby there was what I would term as a misplaced obsession with human rights. You know, masking is against my individual right. It's against my individual autonomy, right? So we did very well. But then, sometime in October last year, we had the third wave, and this was triggered by by two super spreader events. One was the Pilihan Raya Negeri in Sabah, right? And secondly was the outbreak in the detention centers. So the returnees from Sabah were not retested. So they were let loose into the community without being retested, right? And secondly, they were not quarantined. Next slide, please. This confirms the fact, right? From the Ministry of Health itself, no need quarantine if they are tested negative. That's negative at the airport, but they were not retested because there is a false negative rate of about 10%, right? Next slide, please. And this reaffirms the political compliance. No quarantine for voters returning from Sabah. All right. Okay. Next, please. So, I'm a person who sometimes is very loud, and when we do not follow SOPs, then I will call you out, because the government, the Ministry of Health always calls out the rakyat for not obeying the SOPs. And here, in the case of Sabah, in October, I call out the government. I call out the Ministry of Health for not following its SOPs, for not retesting, and for not quarantining, and number 3, for not managing the outbreaks in the detention centers in Tawau and in Alustar. So this is a very beautiful quote from The Guardian. Yeah, sometimes loving your country involves kicking up a fuss. It means taking control of the narrative and telling the uncomfortable truth about a government that is letting its people down. This is from Nesrin Malik. Beautiful quote, in my opinion. And so, I have, since March, April last year, been very, very loud when things were not in order. When the government, when the ministry fails in its SOP, right? And this is very funny because it came from this guy, Rohan, who said, if disaster movies have taught us anything, it is that we will regret not listening to the overly exuberant, loud man with crazy eyes and a messed up hair. So I think you know whom he meant. Next, please. All right. Now, I am not just a loud person. I also do the work of the ground. 31st March last year, with friends in the edge, right? Friends in DIY, Mr. DIY, we flew in about 9 flights from China, bring in PPE and all the equipments required, okay, for the hospitals, right? We were assisting the Ministry of Health. This was a mercy flight that brought us from Kuala Lumpur to bring staff into Sabah and Sarawak. And then with my doctors and volunteers in IMARET, Islamic Medical Association Response and Relief Team, we were the first in Sempurna, Tawau, Sabah, looking after 26 islands, yeah, when there was the outbreak in October. Next slide, please. And for this, the Star awarded them the Golden Heart Award to IMARET. These are all our test kits. We believe in rapid testing, right? We get results within half an hour, 1 hour the latest. These are all our test kits we brought to Sabah. Next slide, please. And these are my volunteers, amazing young doctors and allied health professionals, right? Next, please. So we walk the talk. So what's happened since then? This is the third wave. We've not yet escaped the third wave, and we've had an upsurge. Don't even talk about the fourth wave. This is still part, the bimodal curve of the third wave. Next slide, please. All right. And in fact, at one point in time, the confirmed COVID cases per million people, i.e. per capita, even exceeded India. This is India. This is Malaysia, right? We are well ahead of Singapore, Philippines, and Indonesia per population. So the absolute numbers that you hear every day is not very useful when you want to compare with other countries. Yeah, that's Thailand, Cambodia, and Vietnam down there. Next, please. So things are not looking good. And to make it worse, we were not testing enough. We were at one time at the peak of the October wave. Our testing was 10%, right? The World Health Organization insists that it must be below 5%. The best nations, New Zealand, Singapore, Australia, they were all doing under 3%. In fact, Singapore is 0.1%. Next, please. So, how do we end this pandemic? This is the ABC of public health, or public health management of a pandemic, i.e., find, you test, you trace, you isolate, and you support the families, right? So as I mentioned to you, we need to get to a testing rate, positive rate below 3%. We are still hovering at 5%, right? And when you test, you need to use a rapid test kit, right? You do the test on day one, you should get the results within 1 hour at the place of testing, so that by second day you can isolate. So you prevent the disease from transmitting itself, from spreading. You trace the contacts, yeah, and you quarantine them. The problem with the current testing is that they are obsessed with a PCR. You know, the test result comes back after earliest 2 days, maybe 3 days, all right? And then it's informed to the patient on the 4th or 5th day. And then you have to call them and you have to isolate them. By that time, this guy has transmitted the disease. You know, the sporadic spread has happened, and that's why you get clusters, yeah? And when you test, at one point in time, the ministry was only testing symptomatic patients, i.e. those who had fever, cough, respiratory distress. We should be testing every contact, because this is a study, you can't see this. You know, this is a study we did in my hospital, and we found that half of the COVID patients were asymptomatic, i.e. they did not have any fever, sore throat, loss of smell, no respiratory distress. They were well, but they were spreading the disease. right? That's why we need to test them as well. And when we confirm, we trace their contacts and then we quarantine them. This is what we call a rapid response FTTIS. Next, please. Right. So, if I may summarize, we prevent seeding of new cases. That's why at the borders, we prevent them from coming in. We test them and we quarantine them. We don't want to bring the seeds of the Indian strain, of the UK strain, of the South Africa strain, of the Brazilian strain. And the reason for the MCO, movement control, is that we don't want people from high infection states like Sabah, like presently Sarawak, Kelantan, Kuala Lumpur, Selangor, to be going to the what is described as the green states. Okay, and then secondly, we prevent the spread. Yeah, prevent the seeds from become outbreaks. That's why we look at all the asymptomatic cases. We test what's called targeted mass testing, right? So that we prevent the sporadic spread in the community. So we bust the clusters, and of course, we must protect the social well-being of those who are affected, families, individuals, yeah? And we need to reboot the economy. Next, please. Right. And we know where the places are. The factories, the schools, the community, right? And the construction site. So this is where we need to be targeting. Yeah. Next, please. And this is very important, the S, yeah, because 1 million of our citizens have become jobless. We must see to the feeding and well-being of families. We must pay attention to marginalized communities, yeah, the Orang Asli, the B40. We must make sure that the SMEs and industries are not driven into bankruptcy. We have to look at the mental health. You know, we've seen increased rates of suicides, child abuse, and domestic violence, yeah. And you must remember, our frontline definitely burnt out. How do we care for the welfare of our doctors? And of course, the bleeding national economy. Next, please. Right, there you are. These are the suicidal rates in Malaysia. Next, please. Now, the problem is this. All right, this is us in Selangor. We were doing the Selangka. This is the yellow, yeah? We were registering. And then the government, the Ministry of Health, stopped the sharing of information in September. Look at the rates look at the red line here. This was the number of cases. When we had the information, we could do FTTIS rapidly. But now, no more information. We don't know where are the sites. You see the rates going up. You see? We've lost information. So we cannot do what's called digital and automated FTTIS. Only a few days ago, the government came up with this HIDE. We can explain this later in a minute. Okay, next please. All right, because with our Selangka, we were able to identify this is before October, the red hotspots. Right, we were able to find. When you know them, then you can send a team to do this warp speed FTTIS. And you see, we found in Meru here 5%. In Pasar Besar Kelang, 20%, 1 in 5 were positive. In Taman Bayu Perdana, 1 in 10 were positive. But now we do not have that information because the Ministry of Health refused to share the information. Right? Next, please. All right, and there you are. The data showing Sarawak, Kelantan, Kuala Lumpur, and Selangor. This is the national average. Next, please. Again, you see, we're actually doing very well, Selangor, right? Right. Look at Kelantan, it's climbing. Look at Sarawak, we knew they were climbing. Look at that. Yeah. Malaysia was actually going down until recently. Next, please. So that's FTTIs. It's one of the game changer. The other game changer are vaccines. So is it safe? Right? You have to, at the end of the day, our lives depends on balancing risks and benefits. Next, please. Right? Next, please. And this is the MHRA in the United Kingdom, right? And unequivocally, they've said that the safety data are reassuring. We've already delivered about 1 billion doses of vaccines. So there have been no severe untoward outcomes, right? Except for a few, which we can discuss. Next, please. All right. Let me give you a comparison. You see, we don't have this data in Malaysia, but that's why I have to look at the American data. The risk of an American dying from COVID is 1 in 780. The risk of an American suffering from anaphylaxis, this is a very severe reaction whereby when you're given the shot, within half an hour, you faint, you lose consciousness. You must be resuscitated. What is it? 1 in 400,000. Next, please. The risk of you dying is 500 times. So this is risk benefit, right? Next, please. Next, please. The risk of use of the back one, please. Back one. Okay. The risk of getting a peanut allergy is 12,000 times compared to you getting an anaphylaxis from a mRNA vaccine. But we have not stopped eating peanuts, have we? Right? Next, please. Again, look at this data. This is again hospitalization per 100,000 people. This is death per 100,000 people. This is age group. Again, this is American data. We don't have Malaysian data. How frustrating. This again is the severe anaphylaxis. Okay, I suspect most of you are in this age group. Next, please. 30 to 39. The risk of you being hospitalized per 100K in America is 3,430 per 100,000. Okay, next, please. The risk of you getting a severe anaphylaxis is 34,000 times. Look at here. The risk of you dying is 84 per 100,000 patients. Anaphylaxis. Next, please. 840 times. So I think if you can, if you balance the benefits and the risk, it's quite obvious that the benefits against suffering from being put in a hospital or dying from COVID is much, much more than an anaphylactic reaction. Next slide, please. All right. And that's why we try and protect first, yeah, our health people who are in constant exposure to COVID, our essential workers, our army, our policemen, yeah, ambulance drivers, and then of course prevention of death and sickness, especially in those above 65, those who have comorbidities, those who live in nursing homes. Next, please. All right, and that's why we have these phases. Phase 1, we are now in phase 2. Yeah, dealing with the high risk elders and those with comorbidities. Next, please. All right. Do they work? Of course they do. They've rolled out 1 billion vaccines, and look at the mRNA vaccine. They will protect me. I've had 2 doses, 95%. Right? I still have a 5% risk of getting COVID, but it is mild. It is asymptomatic. I will not be hospitalized. I will not die, inshallah. Okay? Same thing with the Sputnik vaccine, this Novavax, this is the AstraZeneca, Johnson & Johnson, and that is the Sinovac. Okay? Next slide, please. So they work. They are effective, right? Next slide, please. Right. There you are. Not only they claim it works in the human trials, it works in real life. This is Israel, right? They have plunged the cases of COVID by 95%, right? 95 to 97%. This is in Israel. So it works. It is effective. It saves lives. It prevents hospitalization. Next, please. And this is the United Kingdom. This is cases has plunged. This is hospital admissions have plunged. Death has plunged in the United Kingdom when they had previously thousands of cases and thousands of deaths. Okay, next please. Why? Because they have rolled out the vaccines effectively. In Israel, I think it's about 70% now have at least one dose of COVID. In the United Kingdom, about 50%. Malaysia is at turtle speed, 3%. Singapore is about 25%. Next, please. All right. We have a problem because 17% of our rakyat are unsure of the vaccine, while 16% will not take the vaccine. They are refusing the vaccine. Next, please. And this trend has maintained about the same. Only 60 to 65 of our population are willing to be vaccinated. Next, please. So, in conclusion, right, as an end game, right, as an end game to this COVID, we need to practice basic public health, i.e., find, test, trace, isolate, and support to make sure that we have zero tolerance for any sporadic case or for any clusters or for any outbreaks. And we do it with digital, automated, using your handphone, smartphone, right? And secondly, we need a warp speed vaccine rollout, not the current turtle speed vaccine rollout. That is the SOP for the government. This is our SOP as a socially responsible rakyat. The 3 C's and the 3 W's. Yeah? Yeah? And next, please. Finally, 3 golden rules for all of us, because we will be overwhelmed with messages. Firstly, is as Fas'alu ala dhikr. If you do not know, ask people who have knowledge. Right? You don't just read and you forward. Right? Secondly, whenever you discuss something, it must be based on evidence. Ala basiratin. Call to the way with hujah yang nyata. Clear evidence. And finally, when you get any message, you must fatabayyanu. Verify. Validate. Don't just receive and then you WhatsApp the message, which is what happened just this past few hours. The whole of my day was dealing with one audio message, which was purported to be me, which was not me, and it was message and viral, and I had to make a police report. So I hope I give you an overview, and then we can discuss in much more detail any specific concerns that you might have. Thank you very much, Fatin, for being very helpful with the PowerPoint. Yes, Sean, back to you.
Thank you, Dato, for that very comprehensive sharing. Today we hit the 5th highest number of positive cases in a day ever in Malaysia. There are still people, like you say, we are only at turtle speed, 3% only for vaccination. There are many vaccination strategies employed all over the world. Malaysia's priority, like you shared just now, is to vaccinate frontliners, followed by the elderly and those with higher risk, whereas Indonesia prioritizes the young working force first so the economy can reopen, while the older are relatively safe at home. UK's strategy is to vaccinate as many of the population with the first dose first before administering the second dose. What are the pros and cons for each of these strategies, and what are success stories which you can share with us with regards to COVID-19 vaccination worldwide, and how do we do it here in Malaysia?
I think, Sean, as a rule, the scientists are all unanimous in suggesting that the frontliners must be top priority, because inevitably they will be faced with the COVID virus. Yeah, a doctor, a police officer, the army, so the essential workers, no choice. This makes sure that the society will continue to function. the hospitals will not be overwhelmed. The peace in the country will be maintained. That's important. This is to ensure societal functioning. Secondly, the other top priority is to try and save those who are highest at risk, i.e., prevent sickness, morbidity, and prevent death, i.e., mortalities. And who are these people? And I showed to you the risk of mortalities of the 30 to 39 compared to the younger. Yeah, they are at much higher risk of dying or being hospitalized from COVID. If you have loads of them, you're going to overwhelm your hospital facilities, and that's why we prioritize those who are above 65, those who have comorbidities, those who are in the nursing homes, and those who are physically or mentally challenged. Right. So I think this is a great, and the UK, the US, Europe is all going along this. Yeah. Only that they are doing it very, very rapidly, unlike us. We are doing, when Israel started it, the trajectory was like that, virtually vertical. When UAE started it, it was like that. We are doing like this. We are doing very slow. In fact, the minister was saying, hey, we're doing as good as Singapore. Hello. Singapore, when he said that, had virtually 1 case in 2 weeks. They can take their own time. Malaysia had 3,000 cases then. We have about 200 cases in the ICU. Now I think we've got 400. So there is the need for us to be really, really what I call warp speed in getting the vaccine into the arms of our rakyat.
Okay, so when we started earlier, we had a poll. So let's look at the results of this poll. Okay, so the audience was asked how is Malaysia performing. So we have over here that two-thirds say that things could have been done better, and 1/3 says not good at all. So generally, very negative outlook on how Malaysia is performing in regards to containing this virus. Do you share the same?
Well, you see, I think we are doing. Oh my goodness! We had March, right, going on to June, and then we had a period of quiet, isn't it? That was a golden opportunity to prepare for the marathon, to prepare for the long haul. We should have got our systems in order. Nope. We were compliant. We allowed the elections. We didn't take care of our prisoners. We didn't take care of our migrant workers. Some people said, we have overcome. You see, this is what I call futile victory, because we were slapped in October with a wave that is and we might even be worse now, because the Indian strain is already in here, the UK strain is already here, the South African strain is already here, and they are, number one, very transmissible. Number two, they are more serious in terms of the infections they cause. That's why, if you saw my video from Imarep, young people were coming in with stage 3 and 4, and they need to be brought to Sungai Buloh Hospital. Previously, it was just the elderly. Yeah. So, and then these strains are well known to be fairly resistant to the available vaccine. But having said that, be assured that the mRNA vaccines has been shown to be able to overcome these escape mutants. They are still powerful.
But okay, apart from the mRNA vaccine, so are the other vaccines potentially not being that effective towards the newer strains?
Okay, let's be frank. The AZ strain, the AZ vaccine was pulled out of Africa because its effectiveness against the South African strain was only 10%, but it is effective against the UK strain, the B117. Yeah. there are no studies with regards to the Sinovac against all of these strains, because the Chinese have never published their data in a scientific, peer-reviewed scientific journal. So it is very difficult for us to verify and validate. That is my concern about the registration of the Sinovac vaccine. By the way, yeah, it is vaccines which have been published, which have been registered with EUA, emergency use authorization, in 30 to 40 countries in the West and the States, like Moderna, J&J, have not been registered in Malaysia. So I am telling the Minister of Vaccines, the Ministry of Health, you are saying you don't have supply vaccines. The guys from Moderna are saying, have met us, we have the vaccines, but your guys at the top are not registering it. Neither are they allowing you guys in the private hospital to purchase it. If you give us the opportunity, the private side can procure these vaccines, and we can, trust me, we can ramp up the vaccine rollout by 5 to 10 times. Because remember India, when India did its public health vaccination, it was about, I think, 400 doses a day. When they got the private health on board to procure the vaccines and to jab to their private patients, right, at minimal cost, they were able to ramp it to 2 million doses a day, nearly 5 to 7 times. So there you are. So there is a solution.
So some countries are even considering employing different vaccines for the first and second dose, to combat the spread of the newer strains. What are your views on this?
Well, let's be very clear. There's no trials at the present point in time published, but there are studies being undertaken to use mRNA vaccine and AZ vaccine, or to use a protein vaccine and a vector-based vaccine. It is being studied, but no published trials at this point in time. And I don't think any country is doing these combination vaccines, right? So they are sticking to what has been established in the clinical trials. And let's be reassured, the vaccines thus used are doing extremely well. Yeah, doing extremely well because in 2 weeks ago in Israel, they stopped the masking policy. They opened all their schools, yeah, and they were in the States, in the open, and they're not wearing their masks. You see, so we need to ramp up the vaccine rollout.
Okay. So let's have our second poll for tonight. Okay. So would you take the AstraZeneca vaccine if it was made available to you? So recently it was offered to those living in Selangor and Kuala Lumpur, and the minister has said that it will be rolled out to all over Malaysia soon. So A, would you take it? Yes. B, no. C, I'm still on the fence. I'm undecided. Okay, so click on your answer below. Vaccination hesitancy is a huge problem. Let's say in Malaysia, we're still about 60 something, but at the moment, the registration is only probably about 40 something. So it's not only a problem in Malaysia, it is also a problem in countries which has been successful in containing the virus, such as New Zealand and Australia. How badly will vaccination hesitancy affect our efforts to achieve herd immunity? Does the global population have to get vaccinated to eradicate COVID-19 once and for all, like how we were successful for smallpox?
Okay. Okay. You need to achieve about what? 65 to 80% herd immunity. we are in a very difficult situation because we cannot vaccinate below 18, and under 18 make up 29% of our population. So we are left with 70% adults who must vaccinate, and out of this 70%, only 65% are agreeable to be vaccinated. So we are down to what? 45, 50%. Even if vaccine, you know what I mean? So it's a tough call, and this has been fueled by scaremongering, conspiracy theories, fake news, yeah, and anti-vaxxers, yeah, and as a rule, the again, this is, I'm giving pointers to the Ministry of Health. You know, most of the vaccination for adults have been done by people like me in the private sector, the GPs, the family medicine specialists, the internal medicine specialists, yeah, not by the Ministry of Health. You know, the influenza vaccine, the meningococcal vaccine, the pneumococcal vaccine, the shingles vaccine, the chickenpox vaccine are all given by the private sector, because none of these vaccines are in the National Immunisation Programme of the Ministry of Health. So the private people have a lot of experience with dishing out vaccines to adults. This is the opposite with pediatrics. Pediatrics is very entrenched in the Ministry of Health, but adults, it is with. That's why they were very slow to engage with the private practitioners, with the Association of Private Hospitals Malaysia, who have from day one been asking for the permission to procure the vaccines, to give it to all the hospitals in the whole of Malaysia, so that they can ramp up, yeah, the vaccine rollout. But the guys in the authorities are not listening. They think they can do it better, and they've only achieved 3%. So again, this is a way out for them. Trust your colleagues in the private sector to help to ramp up the vaccine rollout. You ask most of your listeners, where did they get their vaccines? Where did they get influenza? Not from the government hospitals, from the private doctors. The private doctors are good at doing this. Engage them. They will help to ramp up the vaccine rollout.
Okay. Let's look at the results for the poll just now. Okay, so what we have here is they're still undecided. So a majority is still undecided, with only 1/3 saying that they will take the thing. So it looks like people are still hesitant. People still fear this AZ vaccine.
You know, the AstraZeneca vaccine is a good vaccine. All right. There are two very large studies. Yeah. First was the UK study based in Oxford, and I think Brazil, 3 other countries. Yeah, and that showed a vaccine efficacy of 60%, which is very good, because they were doing in countries with very high resistant strains, B117 in the UK, P1 strain in Brazil, and in South Africa it was the B1351 strain. These are what we call escape mutants. Yet they achieved 60%, which is very good. And then they had a second study, which was done in the United States of America, which and a few Latin American countries, about 3 Latin American countries, and they achieved a vaccine efficacy of 70%, right? With that, which is very good. But the more important point for your listeners to note is that it was 100% effective against severe disease, i.e., COVID stage 3, 4, 5. Those with pneumonia, those with pneumonia requiring oxygen, those with pneumonia being in the intensive care unit. These are the very sick. 100% protective against them, and 100% protective against death. So brilliant vaccine, very good vaccine, right? Now, the problem with it was that there have been reports of blood clots, or what's called thrombocytosis, thrombocytopenia syndrome. Now, let's be very clear. Again, this is all benefits, risks. If you have COVID, your risk of getting a clot of TTS is 21%. 1 in 5 with COVID will get a blood clot. If you are in the ICU with COVID, the risk of you getting a clot is 30%, 1 in 3. Isn't that enough to convince you? If you're 70-year-old, your risk of getting a blood clot is 5 in a million. Now, how does that compare with if you are in ICU with COVID, 30%, 1 in 3, or if you're in the general ward with COVID, 1 in 5? Very clear, isn't it? The risk-benefit analysis. And not only that, as I mentioned to you, if you're 70 years old, I say it was 5 in a million blood clot, okay? You know what? The risk of you being hospitalized with COVID is 1,800 times. The risk of you dying from COVID is 900 times. So please, tell your father, tell your grandfather, tell your mother, tell your grandmother to go for the AZ vaccine. This is a max vaccine made for you. In fact, as a rule, I think anyone above 50, this is the vaccine for you. Right? Because the risk of blood clot is extremely low compared to the risk of being hospitalized with COVID, dying from COVID, or suffering from a blood clot from COVID. That's very clear. The issue is when you are lesser than 50 years old. The risk benefit is not all that clear. I give you an example. The United Kingdom has advised all those below 30, you must take another vaccine apart from AZ, right? Because they're not quite happy with the risk benefit for a 30-year-old. Many countries in Europe, I can give you 4 at least: Italy, Spain, Germany, France, have said we have to reserve AZ vaccine only for above 50. For the under 50, we have to give the other vaccines. Yeah. So whether it's mRNA vaccine or Novavax, the protein spike protein vaccine, or J&J, the viral vector vaccine. So that's the deal. So I'm afraid the government did not come with such guidelines in Malaysia. They just opened the floodgates to anyone above 18. So I wrote a whole article on this. If you want to read the whole article, you can ask Sean my email address. I will willingly share with you. In fact, it's already published on Code Blue and on the Malay Mail. It gives you the numbers. Yeah. Yes, Sean.
Okay. We will have another poll. And for the listeners, if you have any questions for Dato, please put them in the comment section. We will get Dato to address them for you. Okay. So the next poll that we have, to combat vaccine hesitancy, should COVID-19 vaccination be made mandatory? Okay, so this is your own personal opinion. Yes or no? Okay, should COVID-19 vaccination be made mandatory? What do you think, Dato? What is your personal view on this? Should Malaysia make COVID-19 vaccination mandatory? I know there's some ethical aspects to this as well.
I have never gone along the route of making it mandatory, right? Because you must realize that there are many issues, with regards to the disease, and it's a relatively new vaccine. When I say relatively, when we compare with the other vaccines that we have we've had chickenpox vaccine since we've had vaccination since the 1950s. So we've got something like about 70 years of technology on vaccines. The mRNA vaccines has been around, has been researched since the 1990s. So a good 30 years, yeah. So, but still, we are only 1 year into the trials. So these are early days. So that's why I'm not in favor of making mandatory. I think it's more important that the authorities explain, the benefits of the vaccines and be very transparent with regards to the adverse effects, right? And the adverse effects are very few. Yeah, I can count. The adverse effects with the mRNA vaccines are anaphylaxis. We're talking about severe adverse effects, anaphylaxis. With the mRNA vaccine, Moderna, it's 2.5 per million, right? And with the Pfizer vaccine, it's 4 per million, right? And we've not had any deaths from anaphylaxis because when you get the shot, you're kept in the hospital for half an hour. Because if it's going to happen, it will happen within half an hour. That's the only severe, right, adverse effect. With the AZ vaccines, yes, we have this issue with blood clots, right? And we have to deal with it. And the EMA, the European Medicines Agency, has come up with a very nice plot explaining the risks, right, for the different age group from 20 to 29, 30 to 39, above 70. And what are the risks for hospitalization? What are the risks for death from COVID? And what are the risks for blood clot? And that's why some of the European nations made that national decisions for their rakyat, which we have not. We just above 18 allowed. I think that's not being responsible in my opinion, right? So I'm not keen for mandatory. Explain the benefits, the few adverse effects, and deal with the anti-vaxxers, all right? Every time I had an anti-vaccine message, I will debunk them, whether it is from a doctor, whether it was from an ustaz, a lot of them, right? Whether it was from even a scholar, right? And for the doctors, I have actually mentioned that they should be called up by the Malaysian Medical Council. Explain. If you don't explain, take action against them. I'm not being punitive. I'm just being, you as a doctor, you should be exemplary, because when we did a poll, many of our rakyat look up to the doctors for advice. If the doctor says the vaccine is dangerous, the vaccine causes the face to droop, the vaccine causes death, and he's got no evidence for it, then I think we need to call him out, right? Because when a doctor inspires confidence, then you bring up your vaccine acceptance rate, right? But if a doctor does the opposite, then that just kills the vaccine uptake. Similarly, I've called out the religious scholars. They have said things which are totally absurd, conspiracy theories, and saying that this is not a pandemic, right? This is what is the term they call it? Pandemic. I've called them up, and because when they give the ceramah, they get thousands listening to them. So I think it's important that every one of us play a role, and especially the healthcare providers, the doctors, the nurses, the Ministry of Health leading it. Yeah, Sean.
So let's look at the results of the poll. Okay, so the majority of the listeners, 83% says that it should be made mandatory.
Wow. Yeah. This was the same poll that happened when we were asking for the childhood vaccines to be made mandatory. Exactly the numbers that you but in adults it's very difficult because they are thinking people, they individual rights, individual autonomy, you don't interfere with my public space. My private space, sorry. Yeah, Sean.
So should Malaysia use diplomatic channels to get the excess vaccines from Commonwealth countries, such as bigger Commonwealth country outside? Can we get countries such as Canada, who has 5 times, UK 4 times, New Zealand and Australia 3 times of their population? They have vaccines so much more, respectively. So can we get use your diplomatic channels, get them, those excess vaccines from these Commonwealth countries and accelerate our, tortoise turtle space speed
John,
vaccination program.
that is a faster and cleverer and smarter way of doing it. Right. Number one, the NPRA, the National Pharmaceutical Regulatory Agency, should be registering under EUA, Emergency Use Authorization, the other vaccines that have been authorized elsewhere in the world. The Sputnik vaccine, the Moderna vaccine, the J&J vaccine, the Novavax vaccine. All right. Number one. That's number one. Number two, the Ministry of Health, they should empower the private hospital, the Association of Private Hospitals Malaysia, the states, other stakeholders to procure the vaccine. Why must it be from the top federal? In fact, many of the vaccine vendors, many of the vaccine manufacturers, I met 6 of them. All of them said, it's really better easier to do business with private hospitals with you guys Number one, our margins are better. Number two, there's no middleman. Number three, there's no orang tengah, and then it's very transparent, and things are much easier, which is what we've been doing in the past. Suddenly, when COVID, they want to or they also mentioned no kickbacks, Dato, You see? So there's a lot of money to be made. If you make 10 ringgit on 5 million vaccines, just agaklah how much you already made. 50 million overnight. There's a lot of money involved. Why do you think bamboo companies want to go into vaccines? Why do you think Kaluli steel firms want to go to vaccine? Why do you think my EG is the one that is logistics, isn't it? Not logistics, they are IT, wants to go into vaccine? They've got no experience at all in storing any vaccine, but they know the money is there. So I think it's very sinister, so they're very happy to deal with us directly. So the smarter choice would be allow the private hospitals to do it. I can get the Moderna vaccine at very reasonable and affordable rate. What I'm saying to government is you kept the price. Some of them black market selling for 100 ringgit when I know it's only sold to them for about 50 to 100 ringgit. I know the price, So you kept the price so that it's affordable. So if the private begins to procure and do vaccination, that means you take away from the government numbers, isn't it? So you can move very quickly from fasa 2 kepada fasa 3. The younger ones can move up the scale, isn't it? And also, what about the expatriates? In Selangor, we have about 2 million migrant workers which we need to vaccinate to protect our industries, our construction workers, because we are 25% of the country's GDP, isn't it? Right? And then refugees, 150,000. We have to protect them because these are potential epicenters of COVID. So what about the expatriates? Expatriates never go to MOH for vaccination, They come to us. Now they are at the bottom of the pile. What about those who want to go overseas? Young students. What about the businessmen now near bankruptcy want to travel? They are at the bottom of the pile. They come to us. We can do it. And talk about equity. I'm not touching one single vaccine from the MOH. Talk about equity. All those hujaj, those pilgrims going to Mecca, they will churi about 25,000 of our vaccine. Why? These are all young people. Get them to go to the private hospital and get their vaccines. Now you talk about equity. And what about those Ramadan at night, no need vaccination? What about the about co-religionists, the Christians, the Buddhists, they want their vaccines at night. Why? Because we are fasting, we stop the vaccination at night. This is talking about equity. So I am being very equitable by opening it to the private sectors. So you go and get it there. Right? And then, of course, the T5, T10, they can pay, let them pay. And also, some people want a choice of vaccines. Some want the Chinese vaccine, some wants the Russian vaccine, some wants the American vaccine, someone wants the European is a vaccine. That's a choice. So that's being equitable. That's being democratic. That's a thought, Sean.
Yeah. So the government keeps harping, importance of comply with COVID-19 SOPs. But, it's evidently clear that majority is feeling compliance fatigue, or sometimes known as pandemic fatigue or COVID fatigue, not just in Malaysia, but in other countries which are still battling the virus. How do we overcome this? Everyone wants to go to their mama store, everyone wants to hang out, everyone wants to go back to the old normal. So how do we cope with this?
This is a real issue lah. It's not just rakyat fatigue lah. Please lah. Our healthcare are burned out lah. Oh my goodness, my doctors were in the Taman Stadium Melawati. 1,000 cases a day, and young with stage 3, 4, 5, you cry lah, and they're working there from 8 o'clock in the morning right until buka puasa, 10 hours in their PPEs, oh my goodness. So I think the best way around this is from the start, they should have empowered the rakyat. This is what we call leadership. This is what we call inspiring the rakyat. If leaders don't walk the talk, leaders have big makan, leaders want to show off, leaders having press conference, and passing it on to the media people. There's no leadership. This is very, very depressing for the rakyat. You don't see people walk the talk. That's why when I make a lot of noise, I do stuff. Okay, the whole STFC team was in Stadium Melawati. Okay, right? We where the heat of the thing is there. You have to show this leadership, right? And then number 2, you empower the rakyat. And how do you empower them? With knowledge. And the one that we really need to emphasize is this digital knowledge. On your thing, you press Seremban. Oh, Seremban, how many cases per 100,000 population? Compared to yesterday, how? What's the trend? So, nope, Seremban is high infection rate. You're only allowed to do this. And then work, you're allowed to do this. Leisure, you're allowed to do this. If I did it when I was from the UK, so I look at the WhatsApp there, and I put there Leicester where I was, and I knew exactly what happened the past week, right? How many cases, and then what I am required to do. This is self-responsibility. You empower the rakyat to feel responsible for themselves and for the environment. You see, and then you must be very clear. Your alert system must be well in advance. The minister goes there and makes up SOP, makes up announcement. Oh, SOP will come tomorrow. This is an unthinking government. Yeah, I mean, in the UK, you are at level 1. This is what you are allowed to do. This is what you are not allowed to do. Okay. Same thing with New Zealand. They've got the Selangor Task Force has got the traffic light system. So people know exactly what they can and they cannot do, and they do it well in advance, not tomorrow. So that's why there is this exasperation, with this uncertainty in negotiating this pandemic. So again, at the end of the day, as I said in March 2020, 1 year ago, we fail it from the top. The government has failed us. Our technocrats in the Ministry of Health has failed us. It's and unless I'm very clear here, there is a way out, right? The expert advisory group has been formed. They have advised the government, the Prime Minister, the Minister of Health, and the advice is excellent. You can read it online. Yeah, we need to have a digitalized, automated FTTIS. Contact tracing. You know what? The Ministry of Health is still contact tracing phone. Hello. We have an app. I kena COVID, that app would tell all the people around him, hey, you've been in contact with patient X, right? Please go to the nearest pusat kesihatan, get yourself tested. Meanwhile, isolate yourself. See, this is what we call digitalized, automated. It works on data science. It works on artificial intelligence, and it works on machine learning. You can't be. That's why we are not contact tracing. Your phoning, it's impossible. And number two, warp speed vaccine rollout.
So we do have audience there, but then they seem not to be asking any questions. So last chance, listeners, for you to ask any questions. We have passed the 1 hour mark. Dato, do you have anything to say to wrap things up as we wait if there are listeners to have any questions for you?
I think we are in this together, right? When I criticize, I mean good, right? We want to take up our COVID endgame to this level, all right? And we have to do things which have been proven by science, all right? Politicians must not ignore science, right? If you behave like a Trump, then you get a Trump scenario in the United States of America, okay? And secondly, there are a lot of experts out there. The Ministry of Health must be humble enough to engage with the experts out there, the public health expert, the infectious diseases expert, the expert advisory. The expert advisory group is led by a man of distinction, a former Director General, Tan Sri Abu Bakar Sulaiman. All right, I work with him. I've served him. His heart is for the health of the nation. Trust me. And then he's got great guys with him. He's got the president of the Association of Private Hospitals Malaysia. He's got the master of the Academy of Medicine Malaysia, academia. He's got one of the exco members of the Public Health Association of Malaysia, and he's got a lady who has been a past president of the Malaysian Medical Association. Right, and he's got a sixth person who is an infectious disease expert. These are all the creme de la creme. All right, they are this high in COVID. Listen to them, work with them, give them an opportunity to help you. You can't be doing the same thing again and again and expect a different outcome. You must remember, this is what Einstein said. This is insanity. Doing the same thing again and expecting a different outcome. No, we have to move forward. And I believe we can do it. And if we do it together, let's humble our egos, and then politicians walk the talk and be exemplary.
Okay, we have a question from Tracy. Okay, Tracy Ong asks, there is a lot of youngsters out there think that they want to take the vaccine later rather than now due to the mutation of the virus. What's your advice? To take now and then when come out with new strains and then take again?
You know what? The mRNA vaccines, they've got a cohort of army people who had the vaccines. Now they follow. They had the disease. They followed up and they found that the levels of antibodies are still effective. 1 year. This is natural, right? So there is hope that the mRNA vaccine, because a lot of the research has been done with mRNA vaccine. That's right. I have to focus on them, and I believe it should be with the other vaccines as well. But we're just waiting for the studies to roll out. So the mRNA vaccines have been brilliant, and they're doing very well. So if I had a choice for Malaysia, definitely the Pfizer vaccine is all just saturated. So we're gonna not get from them. But the Moderna vaccines, the vendor told me, hey doctor, you're only one of three, to ask for the Moderna vaccine. The others were Singapore and Taiwan. But I cannot give you because your government didn't register the vaccine. You see? A lost opportunity for us to ramp up. young guys, your risk of COVID, if you take precautions, you practice the 3W and 3Cs, your risk is very low, right? And your risk of being hospitalized is very low. Your risk of dying from COVID is very low. That's why you are at the bottom of the scale in terms of the priority. So we must look after our elders, those with comorbidities. They must be front in the queue because they are highest at risk for getting very severe COVID and dying for COVID. So we must allow them to be vaccinated first. You guys can wait, but I hope you don't have to wait very long. If we roll it up early, then hopefully, like what happened in Israel, now even the younger ones, the 18 and onwards, already have got their vaccine, at least one dose. You know, even that one mRNA dose, as Sean was saying, the protection is 90%. So you can delay the dose, right? In fact, the AstraZeneca vaccine, we delayed for 12 weeks. In fact, with the AstraZeneca, the longer you delay, the more effective the vaccine. Yeah.
Okay. Looks like we do not have any more questions from the audience. Okay, thank you so much, Dato, for spending your time with us in the past hour.
Thank you very much, Sean.
Yeah, we thank you for your sharing. Very comprehensive and very informative. And we hope you and all the other frontliners stay safe and healthy always.
Thank you. Thank you very much to Fatin. She did a great job with the slides.
Okay. That's all we have for tonight. Thank you for being with us since 8 p.m. We would like to thank Greatech for sponsoring this episode of Science Stream. See you again next month for another episode of Science Stream. Good night, stay safe, and selamat menyambut Hari Raya Aidilfitri to our Muslim listeners.